Welcome to our training today on financial considerations when you are discharging your patients. Oftentimes, clinicians are focused on the treatment of their patient, and that is obviously where your head wants to be, but it's also a good thing to understand the financial concerns and limitations your patients might have, especially as you're discharging them back home or maybe to a long-term care facility for rehab. Some things that patients and their families are thinking about if you're discharging them to a facility is, of course, the cost of what that care might be. The quality of care, of course, is something they're looking at as well. Convenience, especially when it comes to the family caretakers. They want to make sure that it's easy to get to and be able to help their family member out. The continuity of care, making sure that that standardized care continues from the clinician's setting into that facility and that everything stays standard and going towards the direction that they want to take. The current capability of the patient, and will this be a long or a short-term stay? That is going to be in their minds as well, and that, of course, ties into cost. And their medications review. What are they currently taking? Is that going to be available to them at their facility? Is it something that they need to be aware of interactions? Will the new facility understand everything they're taking and any possible interactions that might be going on with those medications? If your patient is being discharged to their home, some other considerations that they are having is personal care. Will they need somebody to come in and help them now with care, with things like bathing? Will they need a meal service? Will they need help showering or toileting? These are things that could very well be first and foremost in their minds. Will they need help with chores, just doing things around the house, laundry, dishwashing, meal preparation? Do they need an in-home nurse to help them with their health care as they recover from whatever procedure they've had in possibly a hospital setting? And their emotional care as well. They want to make sure that they're still being social and using their mind and being socially active so that they don't fall into a depression. Remember, it is vital that the caregiver is also considered when planning patient discharge. Many people feel that Medicare will cover the cost of long-term care, and unfortunately, this is not the case. Medicare is a federally funded program that is optional to enroll and available to everyone age 65 and older. However, Medicare does not cover long-term nursing home care due to disability or if someone is unable to care for themselves just due to the aging process. It does not cover assisted living stays or adult daycare services. Medicare also does not cover custodial care, so those activities of daily living like assistance with eating, bathing, or dressing. What does Medicare cover then? As you can see, there are several parts to Medicare, and these are all generalized terms. So when you are looking at your Medicare coverage, it is important for your patient to look at their particular plan that they have chosen. But in looking at these guidelines, Part A will cover hospital costs after you pay a deductible. It will pay short stays in a nursing home if hospital-related care is involved. And it will also cover hospice care in the last 6 months of life. Part B will cover part of the costs for doctor services. It will cover outpatient care and other medical services that Part A does not cover. And Part B will also cover some preventative services like flu shots or diabetes screenings. Part D can cover some medication costs, but again, it's imperative that your patient look at their particular plan to understand what their Medicare will pay for and will not pay for. There is also a Medicare number that you can call, or you can go to www.medicare.gov for further details if you would like to understand more of what Medicare will and will not cover. Some statistics we'd like to review with you just to get an understanding of how many people have considerations due to cost and feasibility when they are being discharged either to a long-term care facility or back into the community. It's estimated that 12 million Americans needed long-term care in 2015. As you can see, that statistic was taken quite a while ago, so think about how many more people need long-term care now and how much more that will grow. It's also estimated that by 2050, the number of people using paid long-term care services will double to 27 million people in the United States. Older adults with limitations in 3 or more activities of daily living who live in the community receive an average of 9 hours of assistance each and every day, and that rises to about 11 hours of assistance per day in people 85 years or older. In 2004, the average daily rate for a private room in a skilled nursing facility was $192 for a private room, and that's about $70,000 each and every year. $169 annually for a semi-private room, and that's about $65,500 every year. And the hourly rate for a home health aide was $18.12. That again was in 2004, so think of how costs have increased in that time from 2004 to now. 1 in 4 people over 45 are not at all prepared financially should they suddenly require long-term care. As you can see, it's very important that clinicians definitely keep in mind those financial considerations for their patients and make sure you're asking those questions if they're able to pay for those services and if they need resources. Throughout this presentation, we will share resources with you so that you can offer those to your patients. How can people pay for long-term care then? Some people do have personal funds available to them, such as personal savings, retirement funds, investment income, or if they have funds available from the sale of their home. Some people are able to do that, although national average is only about 5% of people are able to use personal funds to pay for long-term care. There is also long-term care insurance, and a lot of those will include palliative or hospice care. Again, we encourage patients to review available insurance plans to them so they understand fully what will and will not be covered in those long-term care coverages. State Health Insurance Program or SHIP programs are available. They offer counseling and assistance to people and their families on Medicare, Medicaid, and Medicare supplemental insurance or those Medigap plans. In Ohio, it is the Ohio Senior Health Insurance Information Plan or program, and you can see our website down below, www.insurance.ohio.gov. You can go there and OSHIP will be contacted. There is also a phone number of 614-644-2658 for general information, or the consumer hotline is 1-800-686-1526. State health insurance programs, or those SHIP programs, are free to contact and offer assistance. Other ways people can pay for long-term care insurance is Medicaid. Medicaid is both federally and state funded. It is designed for lower income individuals, but it does have strict asset and income limitations. It will cover long-term nursing care where Medicare will not. You can always go to their website, which is https://eligibility.com/Medicaid, and go to which Medicaid programs are available to you and how to enroll and the guidelines for them. There are also Medicaid waiver programs available to you, and they can cover care outside a nursing facility. So if you are going to an assisted living or you need in-home care, those Medicaid waiver programs can help pay for those services. There is also dual eligibility, which means the patient will be eligible for both Medicare and Medicaid services. So while Medicare will not cover nursing home stays, Medicaid waiver will. So you can ask and see if your patient would be eligible for both Medicare and Medicaid services. If your patient is a veteran, you can also guide them to VA services. They may provide long-term or at-home care for some veterans. And you can go to www.va.gov/health to inquire about those services, or www.caregiver.va.gov, and that has guidelines for caregivers, or you can feel free to call them at 1-877-222-8387 for questions you or your patients may have about those. Other resources that can help with programs and services and supports for your patients: area agencies on aging. They are nationwide, and they are organizations that are designated by the state, and they address needs and concerns of older adults both at the state and regional level. To find an area agency on aging in your area, you can visit www.n4a.org, and that is the website for the National Area Agency on Aging site. There is also the National Council on Aging, and they offer a free service called Benefits Checkup. For more information on that free service, you may go to www.benefitscheckup.org or dial 1-571-527-3900. That program can help find federal and state benefits programs, aiding and paying for prescription drugs, heating bills, housing, meal programs, legal services, and more. You can also visit www.benefits.gov. That has information both on a federal, state, and local benefit level. They also have a toll-free number, 1-800-333-4636. And finally, the U.S. Health Department of Health and Human Services, they have a program with the National Institute on Aging, and their website is www.nia.nih.gov. In conclusion, it's important that we as providers understand that each patient's circumstance can vary widely from one person to the next based on their income and assets. If your patients have any questions about programs available and how to enroll, they are able to call the Aging and Disability Resource Center, available through Area Agencies on Aging. It is a free resource offered through those area agencies, and they can answer any question as far as eligibility and how to begin those programs. Thank you.